Thank you for joining me for the Mouthy Matters podcast. Today, we're asking the big question, do you really need that deep cleaning? I am your host, Tosha Kozlowski. I've been a dental hygienist for 21 years, turned practice coach. I help teams to take better care of their patients through their oral health. And today, I am here with my bestest friend, Lisa Charles. Thank you for being here.
Thank you so much for including me.
I'm so excited for you to be here because this is a topic that I just absolutely love talking about because there's so many misconceptions about what a deep cleaning is, what it really should be. There's a lot of confusion when people have been coming in regularly, going to get their teeth cleaned, and all of a sudden they have this giant cleaning bill that they were not expecting. So today my goal is to tease out all the details that we want to include in that. So if you're listening and you are a dental provider, these are some of the questions and some of the informational topics that I hope that you're talking to your patients about. So shall we dive in, Lisa?
Absolutely. Question.
All right, let's do it. Let's do it.
Okay. When a patient hears you need a deep cleaning, what do they usually think that means? And what is the biggest misunderstanding?
So the first biggest misunderstanding is that it's called a deep cleaning. I don't know about you, Lisa, but it sounds a little painful to me. It sounds like something, deep. We're going to go deep in there. We're going to get to those roots. We're going to get the barnacles off those surfaces, all those kinds of things. So what I found for myself as a dental hygienist, I said that a lot. I used the words deep cleaning. I used the word scaling and all these other very dentally terms. And they truly didn't describe what was actually happening in this person's mouth. So the biggest misconception of a deep cleaning is what should it actually be and why does the person need it? So a deep cleaning is not or shouldn't be needed just simply because somebody has a quote unquote dirty mouth. They have heavy debris. They have hardened calculus or tartar in there, lots of plaque. Some people have the misconception that a deep cleaning is for somebody that's maybe taken a dental sabbatical. They haven't had their teeth cleaned in a long time. And so now we're making up for lost time, which it's not that that can't be true. It's just that when it comes to what's called periodontal disease, the typical treatment for it is a quote unquote deep cleaning, but it really should be so much more than that because periodontal disease or gingivitis for that matter are from coming in contact with different bacteria, your immune system doesn't fight it off, and you now have an infection. So does a deep cleaning or really treat the infection? Like if I clean your gums and your teeth really well, like is that going to treat the infection? Well, maybe. It depends on what exactly you're doing. So the reason for a deep cleaning is typically because that person has been diagnosed with gingivitis or periodontitis, which are both infections of the gum tissue. There might be debris alongside of it, but there might not be. So I personally wish that the dental community would stop using the words deep cleaning because I don't think it's communicating to the patient what they actually need or what they actually have, which is an infection of their gums.
Yeah, I would venture to say a lot of times the hygienist or whoever clinician will say, you need a deep cleaning, but maybe they haven't told them that they have gingivitis. And that could help a lot, right? We've talked before about how different people will get different information when they go to the dentist and maybe they have the same infections, but one person is told they have that and the other person is not. And so evening that out so that everybody is getting the information that they really need so that they understand the treatment and why the treatment is necessary, I think would be such a great way to get everybody on a level playing field and make it easier for the patient and the clinician, the hygienist as well, because then you're not convincing.
Exactly. And part of that diagnostic process is fairly confusing to a non-dental trained person. So we're talking a lot about pocket depths. Oh, Lisa, 1 to 3 millimeter pockets are normal, but healthy gums don't bleed. And you have 14 bleeding sites and 15 4 millimeter pockets and 3 5 millimeter pockets. And you have radiographic bone loss and blah, 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 blah. Our poor patients turn to bobbleheads because they're like, what language are you speaking? And then they keep on babbling on about this deep cleaning that's needed. Maybe there's a laser involved. Maybe there's some other stuff involved. And then they get the price tag and there has been no communication back and forth. And so many people just feel completely overwhelmed by this new information, especially when they've been seeing their hygienist every 6 months.
Yes. Like, why is everything different now? why do I all of a sudden have this? But it's also like going to the mechanic, they're speaking a different language. If you didn't grow up working on vehicles, which I actually did, and I still go sometimes and I'm like, I understand how an engine works, but I don't know half of the things you just told me. So I can't imagine. And same with me going into a dentist and getting a cleaning. Luckily, mine are pretty basic these days, but it's so confusing. And you end up just going, okay, fine. I guess I have to say yes, but begrudgingly, It's not
and that's the worst thing. I never want a patient to say yes to me because they feel like they should, just simply because, well, I trust Tosha, so I guess I'll do what she says. Because I found that so many of those patients were not a willing participant in the treatment because of the lack of understanding. Like, I didn't explain to them the whole process. And we'll get into what that whole process should be and how it's a team effort. But yeah, so that is definitely a misconception.
I agree. Okay, how about number 2? Why can't we just clean it really well and move on?
Yeah. That's what we've always done, right?
Yeah.
It's just a really good thing and move on. So when it comes to gum infections, any dental professional that knows me, or if you're my family member, you know how much I love a microscope. So the reason I love a microscope so much is because all I do with my patients is I take a little piece of plaque from their mouth and I put it on the microscope and I put it up on the TV and show them if they have healthy bacteria or unhealthy bacteria. But before even that, I'm going to evaluate my patient's gum health. I'm going to do my periodontal probing. And I know a lot of people don't like when we're poking around at their gums. It shouldn't hurt. If it does hurt, typically it's a sign that the person has gingivitis or has periodontal disease. Most of the time, it's not because you have a heavy-handed hygienist, but it can totally feel that way. It's kind of like if somebody has inflammation, it's kind of like we're just banging on a bruise. Like, let me just smack that bruise on your arm, Lisa, and see how it feels. If the gum tissue's swollen, it doesn't feel very good when we're poking around the gums. Now, that doesn't mean that that patient is having tenderness at home, but we can get to places that people can't get to. That's why we go get our teeth cleaned, because we can get in the nooks and crannies that you can't at home. But if there's an infection, so if I have a patient that I'm seeing signs of inflammation, because I start with their periodontal evaluation, which all of us should be doing a gum tissue charting. For some reason, it's fallen out of fashion. Some practices are doing it maybe once a year. And I've recently come across many that are not, that just, friends that have gone in and gone to a different dental office and all of a sudden been told they need a deep cleaning. And they're like, why? And they try to get their records for their periodontal charting and they've never had one. And so, like, where's your roadmap? How do you know what the tissue condition is without that periodontal charting? So that's number one. Like, we really want our dental hygienists to be doing a periodontal charting every single time, because that's a really great roadmap of where do you look today. The next step that I do that not every practice has is that microscope. So are there bacteria living in the mouth? Because if there are and they're unhealthy, that doesn't mean that they're just in your mouth. That means they're inside your gums. And if they're inside your gums, they're inside your body. We know that one study found that, 98% of patients that passed away of Alzheimer's disease had bacteria from their mouth in their brain. How did it get there? So essentially, the bacteria that we can see on a microscope, we know that they shouldn't be there. So it's very akin to termites in the foundation of a house. And we know that if you start to see termite damage on your house, how bad is the problem, Lisa, by the time you see it?
Oh, yeah, it's too far gone.
It's bad. So we want to catch these things super early. So I personally believe in showing as much as we can show. And if a practice doesn't have a microscope, we can take photos for the patient, because, I don't know about you, but I can't see my top teeth, my top gums, unless I'm putting a mirror in my mouth. And so that type of photography also shows it. So if I have an infection inside my gum tissue, no amount of really great cleaning, even if I think I'm the best hygienist that walked this planet, I cannot just do a really good, air quotes, cleaning to get that infection out of there. And so I think jumping back to, do I need a deep cleaning? Well, if you're just literally cleaning harder below the gums, that too will not treat the infection. So it kind of comes down to, what are we doing? So I think that's part of, I'll jump right into our question number 3 is, why do some people feel blindsided?
Yes.
Because why do they need a deep cleaning if they've been going to get their teeth cleaned every 6 months? Well, if you think it's because you have a dirty mouth problem, it clearly doesn't make sense. But, I know for my daughter, she used to get strep throat all the time. All the time. I swear, like every summer break, like she always wanted to do gymnastics camp, and it's a petri dish. And it was always the same thing. And for some reason, I would get amnesia about it every time. But she would come into the room about midnight after she'd been at gymnastics camp for a couple days. And she'd say, Mommy, my tummy hurts. And I was like, oh gosh, how does your throat feel? She's like, it's kind of sore. Yeah. And every time she got strep throat. Well, did she get strep throat because she wasn't cleaning her throat well enough all of a sudden? Or was it that she came in contact with this bacteria and her immune system just could not fight that stuff off? So poor thing had lots of rounds of amoxicillin. We did the airway stuff to try to fix it all on its own, but eventually we had to resort to removing her tonsils because I didn't want her on amoxicillin, every few months. And so the same is true for periodontal disease. Like we come in contact with this. We know that the primary offenders of a gum infection are parents, partners, pets, sometimes contaminated food and drinking water. Are you going out to happy hour with your friends and maybe they have a really delicious looking cocktail and you take a sip of it? Are we, having a communal kind of meal and some people are double dipping? Well, maybe you get some of their bacteria. Maybe your dog licks your mouth or sleeps in your bed. Dogs by age 3 I think it's actually by age 2, 70% of them have gum disease already. Those same bacteria, they share it with us. If our immune system doesn't fight it off, we get sick. So when we talk about periodontal disease and gingivitis, it's not a dirty mouth problem. It's an infection problem. So it changes the entire conversation of why do I need this? Well, you could be getting your teeth cleaned every 6 months. But then all of a sudden life gets stressful, like you're maybe under the weather, you come in contact with some different bacteria. We don't always know where you got it. We don't know. But what we do know now is how to get rid of it. So you came in contact with infection. If you have some deeper areas in your gum tissue, your periodontal pocketing is deeper, that's a lot of nooks and crannies that are super hard to clean at home.
Well, and it's an issue I'm dealing with right now. You and I were just talking about this. I have a tendency to bite my cheek and my lips and my tongue. And guess what? Then I end up with these ulcers. Well, prime breeding space for anything that any bad bacteria, any bad bugs, like you're saying. I'm sitting here this last week like, man, I know where they're going.
There's a constant open wound.
Yeah. And so, we're talking about flossing in this tiny little micro paper cut of, in between your gums. Well, something like this, you don't think about unless you understand that the mouth is not a box. It's connected to everything else. And I feel like that's the root of everything that you have taught me. So I greatly appreciate it.
My pleasure. My pleasure.
Well, how about we go to number 4?
Let's do it.
All right. What should a modern deep cleaning actually include?
Well, number 1, it should not be ever called a deep cleaning. If you want to put deep cleaning, you put that in your clinical notes, dental professionals. But what it really should be is medicated therapy, gum tissue therapy. So I train my teams to use a 3-tier approach, which is what are you going to do for the patient in the office? What are they supposed to do for themselves at home? And what about their immune system? And 2/3 of that equation truly is on the patient, which is awesome because they can take control of their health. It's not just up to the dental professional because, for me,
ownership.
Yes, they get to take ownership, for better or for worse. I used to joke with some of my patients, like, I'm not coming home with you to brush and floss your teeth and to use your water pick for you. So if I see you 4 times a year, there's 365 days in that year. 361 of them is all on you. So good luck. Let me show you exactly what I want you to do. And it doesn't have to be like a 10-minute routine. I mean, I'm talking 6 minutes a day total. Can change your life, can change the overall health of your gums, especially if you have an early infection. Like if you're already noticing that you have some bleeding once in a while when you brush, once in a while when you floss, when you're looking at your teeth, if you really like pull your lips down and kind of look in there, if you're not seeing any like hardened debris, this could be the earliest signs of gingivitis. And you could literally reverse that on your own, depending on the severity of it. Now, if somebody has periodontal disease, that means that you've actually had an infection for so long that those termites in the foundation that we talked about have already eaten your jawbone away. It's actually the body that dissolves it. But for an easier analogy, the termites in the foundation, I feel like, is much easier to comprehend. And so what we should do for the patient in the office is not just a deep cleaning. We need to use some type of antimicrobial. We're dealing with an infection, friends. So what are we using for that? So most practices have some type of ultrasonic device. They can use some type of medicament in that to help to get rid of the bad bugs and supercharge the good bugs. There's a lot of different types of medicaments that practices can use. What many practices do is they'll use ozone water or ozone gas, or they'll have laser therapy. There's a lot of great technologies that these practices have to be able to get to the bacteria that's causing this infection. Yes, they still may need to use their hand instruments to remove any hardened debris that might also be alongside of this infection, which isn't super uncommon simply because if somebody has infection in their gums, it changes the pH, it changes all the good properties about our mouth and can make it so that we build more hardened debris. So there's a lot of different dysbiosis that happens in there. So the mouth can just be the saliva can feel more ropey. Your mouth will feel less fresh. Some people experience a lot of bad breath. The bacteria that cause gum infections, a byproduct are these sulfur compounds, which means that you could have bad breath and you don't know that you have bad breath, but your friends and family know that you have bad breath. Right. And that's not just in the morning and at night, but like throughout the day, even if you're doing a really great job. So there's all these random side effects that are going on because of the bacterial infection that you're dealing with. So in the office, it's full mouth bacteria reduction is our primary goal, or it should be our primary goal. And if there's hardened debris, get rid of that too. And then that bacteria is not just in the mouth, it's in the gums, which means it's going to try to flush back into the mouth and rebound. That's why we have to go see our dental hygienist multiple times typically to get this infection control. Simultaneously, then we move into tier 2. So number 1 is what we're doing in the office, antimicrobials, full mouth, repetitive therapy. That's what science shows us is the best. Number 2 is what that patient is doing at home. So for me, every single patient under the sun needs a water pick. I do love the brand Water Pick. It's just been the best, most robust. Don't buy generic tips for your water pick. I like the pickpocket tip. You can go to my website, mouthymatters.com. I have a free downloadable sheet that tells you exactly how to do all these things that I'm telling you right now. I'm just like a really nice user guide. But with the water pick, you want to use that every single day. And I have a video in there that shows you exactly how you use that water flosser. Technique is everything.
That can be intimidating. I have friends who we were discussing a water pick and I was explaining to them why it's so important. And they're like, man, I tried and the water went everywhere. And so I sent them your how-to so that they could learn how to do it without spraying water all over the, shower or the mirror.
It's 100% a squirt gun. I mean, so if I were to, shoot that water pick tip right at my computer screen now, it's going to ricochet right back at me. So it's certainly not a device that you're just like, oh my gosh, I know exactly how to do this. But the same is true for brushing your teeth. I mean, Lisa, you're in my brushing your teeth video. Yes. And it's not just what we think. Like, we don't just brush your teeth. We need to brush your you need to brush your gums. You need to brush your palate. Even scraping your cheeks, getting a tongue scraper for your tongue. The bacteria live everywhere and they don't want to leave your mouth. They found a beautiful home. They're really happy. They want to build their community there. They want to build a whole community of new little baby bacteria. So we need to evict them daily. And so if we're doing that daily, we want to use our water pick every single day, at least once a day. If you work from home after lunch, just water pick. Whatever time of day floats your boat is just fine. Just make sure you get through the whole mouth, outside, inside. Brushing your teeth is imperative. And you're not just brushing your teeth to remove plaque and food and stuff like that. You're trying to disrupt the bacteria's home, which is why you need to spend that full 2 minutes. An electric toothbrush does work better. The electric toothbrushes that are battery powered can be hit or miss. A lot of them, as the battery is wearing out, we don't really know. And so they're not as effective. And so I do prefer a rechargeable one over one of those. So whether you like your Sonicare or your Supermouth electric toothbrush, it's very similar to the Sonicare, Oral-B, whatever, just a rechargeable one. They're typically just better. I tell people, like, if they're not already flossing, floss when food's stuck in your teeth. I'm not going to die on that hill. If you're water picking every single day, you're going to be able to remove the majority of the bacteria out of there, and you're disrupting where they're living underneath the gums. And if you have food stuck randomly, like, use some floss. Like, that's just good practices. Right. And then the next thing is that immune support. So it's what we do for the office, what are we doing at home? And then that third part is the immune support. I personally didn't learn anything about this in school. Like, this was all like way after the fact of what do we need to do. I, of course, knew that diet and lifestyle played a role, of course. But I didn't really know how to guide my patients. And so now my go-to is Protectin, which is like a probiotic, but it has a really neat different mechanism of action. So it has a decoy sugar molecule. So it's this fiber that looks like sugar. So unhealthy bacteria that cause gum infections, that cause cavities, they like carbohydrates. That's how they eat constantly. And that's what gives them their superpowers to make us sick. So what the protectin does is it starves them. So they see this decoy sugar molecule, they eat it up, they're full, and they move on. Simultaneously, though, that same protectin has prebiotic and probiotic, so it's feeding the good bacteria. So we can get the balance back. We can feed our good guys with starving our bad guys, which is exactly what we need. But then also it's looking at our patient's medical history. Does this person suffer from diabetes? Well, diabetics know that if they, are staying up too late, have too much cortisol going on because they're stressed out all the time, they're not eating right, they're not exercising, they know that that's not good for their A1C and their blood sugar levels. So mentioning that this is a two-way relationship with our diabetics, that the gum infection that we see could be making their diabetes worse. Do you want to mention about your dad's story?
Sure.
All right, do it. Because I think it's a good little segue into how this affects real life.
It is. I agree. My dad was diagnosed with diabetes at a much later age, and he also really suffered with, I would notice how bad his breath was. My mom would make comments. My dad's at-home care was pretty great. He was flossing every day. He was brushing his teeth, he did a lot more than I did, honestly, at home, but it wouldn't let up. And so Tosha came over and did a little saliva test type thing with one of the products that you guys use a lot. And luckily, my dad jumped on board once he was able to see what these bacteria were.
So the lab test that Lisa's referring to is called MicroBlink DX, and they do salivary diagnostics they're looking for specific microbes that cause bleeding gums. And so that's another great test that many practices, any dental practice can do this, but it's just these paper points. You place them right the same area where you're doing your periodontal measurements. It's super easy. It takes 10 seconds. You just place them in there. That soaks up the dead bacteria. That goes to the lab, and the lab tells the person quantitatively how much bad bacteria do you have and which ones do you have. So you actually know what type of infection you're dealing with.
Right. So then they can decide what type of treatment moving forward. So my mom was also tested per your advice, and my dad called me, and he wasn't a believer in all of these things. He's the very standard, grew up in a different generation where you didn't really ask questions. You just said yes, and, the doctor knows best kind of thing. No fault of their own. But in seeing this data, he jumped on board and did all the things, luckily got a dentist that backed this test and gave him an antibiotic and gave him the oral rinse and did the laser gum therapy, the whole 9 yards, cleaned up his mouth. He was having to go see the dentist every 6 weeks, I think it was, or every 3 months, something like that. And this last time that he went, they said, no, we'll see you in 6 months, because everything looks so great. His blood pressure is dropped. His A1C, I don't remember the number, Tosha, I told you before. I think it dropped 4 or 5 points.
Yeah, it was quite substantial, because I feel like you said that he had suffered such a strong word. He had had a hard time decreasing his A1C. And with diabetics, if they have a gum infection, it can be nearly impossible if there's gingivitis or gum disease going on, because there's too much infection in the mouth to bring down those A1C levels. And so it's been scientifically proven over and over again, by having gum tissue therapy, by getting a gum infection under control, diabetics typically see 1 to 2 point reduction within 3 months. It's crazy.
Well, that tracks, because his was, I believe, 6 months. And it got down into the normal healthy range for the first time since he had, before he had been diagnosed with diabetes. And that was without much, if any, diet change. I mean, we like our food in my family, and, my parents have changed some of their oils that they cook in and things like that. But anyway, it felt like a miracle. He also can feel the difference. He can see the difference. There's no bad breath anymore. It's been life-changing. And I know that it makes his entire body healthier. Obviously, that's the biggest thing. And his quality of life and the length of his life. It all adds up. So he's really grateful. and has come back and like, hey, tell Tosha that my A1C was this and that.
I'm
He's
so proud
excited
of
about
him.
seeing some results.
Which is amazing. I mean, when somebody's dealt with gum disease for many years of their life, it can feel so defeating because unfortunately, I think some of the messaging in some dental practices is that it's like a shame issue, like, you didn't do a very good job at home and you're not, I don't believe that you're actually, flossing and brushing every day because you wouldn't have these deep pockets if that was the case. And that is just not true. It is not a fault issue for the most part. I will say, of course there are some people that probably could do a whole lot better at home and wouldn't suffer from these issues. But so many of my patients, I know they did a great job and they still came in with bleeding. And I knew that it wasn't because I was a failure as a hygienist of not cleaning their teeth well enough at their 6-month cleanings. And I also knew that they weren't just, refusing to brush and floss at home when they weren't seeing me. So there's something more going on. And as science progresses, we have learned so much more. We know so much more now in dentistry than we did 21 years ago when I graduated. So the conversation truly needs to be different. So using a three-tier approach to really help to get our patients healthy is how we get our patients healthy and keep them healthy over time. And while we can get people healthy, that doesn't necessarily mean that we can immunize you from it. My daughter's had her tonsils removed. She hasn't had strep throat since, but I can't guarantee that she's not going to get strep throat again just because we lopped out those tonsils. In fact, it's an infection. She may still get strep throat at some point in her life, just like somebody can get gum infection again. We can't immunize you from it. My goal with my patients is to always find like their secret sauce. So it's like, what specifically do they need to do to maintain their health? Yeah. And if I'm, dealing with somebody that's in their 20s and maybe they got a little slacky because college was too fun. And then we get them healthy and on track and then they get a new honey in their life. Well, how healthy is your honey's life? And are they sharing more than their love with you?
Yes.
I suggested test it as well, because if we're living in the same household, we're smooching, sharing drinks, sharing food, things like that, like we're just going to pass that bacteria. So when these little kids come into practices and they have bleeding gums, my first thought is, who's your primary caregiver? Mm-hmm. Because
can we get them tested?
It was shared. Yep.
Yeah. Well, speaking of conversation, our last question is, what should a patient ask their dental team if they are told they need a deep cleaning?
Yes. So great question. So I want every patient to ask why specifically they're being recommended this and ask them to speak in layman's terms. Like if they're giving you a bunch of dental terminology, that can just be an accident for us in the dental field because the vocabulary that we use is so normal to us. And sometimes we forget that that's not regular vocabulary to the common person that doesn't work in a dental practice. So from a pocket depth standpoint, I got rid of talking to my patients about pocket depths because I just didn't feel like I was getting through. But if you don't have a microscope, that is one really common one. So if you have 4 or 5+ millimeter pockets, that's not normal. That is telling the dental professional that you have had an infection that has actually necrosed and removed some of the bone. If you're seeing like a lot of recession and those areas are tender, recession can be a sign that there's been gum infection, but it also could be a sign of clenching and grinding and a few other things. But you want to know, is there bleeding when you do my periodontal charting? Like any bleeding, y'all, is not good. I don't care if it's one spot of bleeding. Because if somebody's measuring around, if we're measuring around with our ruler and there's bleeding spots, then when we start cleaning, it's going to be bleeding everywhere. So you may think that we're suctioning spit, but we are suctioning blood. We may just not be sharing all that with you. And so pocketing indicates infection. So you could even have 2 and 3 millimeter pockets that are considered normal. That means you haven't lost any jawbone. But if there's bleeding points, bleeding sites, that's a sign that you have an infection. I would also ask the practice, is there any way that you can identify the bacteria? Because if the practice has a microscope or they're using salivary diagnostics, you guys want that. The saliva test, it will cost you more money to get, but it is great data. Then you know what bacteria is causing this infection and we're not guessing. And then after the therapy, you can do another test roughly about 3 months later to make sure that therapy and your home care and that immune support piece worked. Because sometimes the dental professional gets the mouth really clean, but they're still bleeding, which means that the termites didn't go away. Like you maybe cleaned up their house, but they dug deeper down. So we want to make sure that infection's under control. And then what are the steps after the deep cleaning, after the gum tissue therapy? So what is their plan to manage you over time? Because it's really important to have realistic expectations, because many people, after they go through a gum tissue therapy, deep cleaning, whatever word you want to call it, will be recommended to come in much more frequently. So, for my practices that use a microscope, I'm having those dental hygienists take a plaque sample every single time so that they can show the patient where they're at. And then that patient knows, okay, what I'm doing is working perfect. My microscope slide looks great. My clinician's telling me that my gums look great. Like, I'm using my water pick every other day. Like, I'm brushing my teeth twice a day, 2 minutes. I'm using that tongue scraper, flossing when food is stuck. That's clearly working. So just keep on doing that. But other people might be doing all the things and they still have infection. Then we need to, go back to the drawing board. Maybe that person needs to come in every 2 months to get their teeth cleaned, because we can get into the nooks and crannies that they can't at home. So there should be some flexibility with that long-term treatment plan, because we want to treat that person as an individual, not just like gum infection. We always do this. Well, my immune system's not the same as yours, Lisa. Like, it might be a little bit different. So I might need a little bit more tender loving care and more attention, where you might just be able to just kind of do whatever. Like, my husband's that way. He didn't have to do a whole lot of anything. And he's like a freaking unicorn. It's not fair.
Mine too. Maybe it's the name. Our husbands have the same name, which is hysterical.
Totally. What else? Let's see. And then and then I would also ask, like, how do you know that the treatment was successful? So this, again, is just helping the patient and the professional be on the same page. So if I was going to explain to you, Lisa, that you needed, let's say, gingivitis therapy, I would say, okay, Lisa, I'm seeing signs of inflammation in your mouth today. There's bleeding when I'm measuring around your gum tissue. That tells me that you've come in contact with some unhealthy bacteria and your mouth now has an infection. We call this gingivitis because the infection is in your gums, but it hasn't reached it's not inside your bone, and we're not seeing any bone loss yet, which is great. So the next step really is going to be that I'm going to do a medicated cleaning here in the office, and I'm going to have you come in multiple times so that I can use medicine and flush out your gum tissue. If there's any hardened debris in there, I'm going to get that out as well. But the second part is probably the most important part, and that's what you're going to do at home. I'm going to teach you how to use a water flosser. I'm going to ensure that your toothbrush technique is solid, and then I'm going to tell you about a tongue scraper. And then from there, it's going to be with the immune support piece. If your immune system, like, there's nothing special on there, like you're just really nice and healthy, I'm going to say, you know what, go on Daily Dental Care's website, get yourself some protecting, get just one bottle, and just suck on 4 minutes a day. That's going to just help to starve these bad bacteria, and it's going to help to support your good bacteria. Long term, after 6 weeks, we're going to see how your gum tissue looks. If there's a lot of improvement, I'll probably do your next regular cleaning in 3 months. But we're just going to see. Like, I don't know how well your immune system's going to fight this off. I can't predict what you're going to be willing to do at home. But at 6 weeks, that's really going to help me to know when your next regular visit should be. And then from there, it's, what questions do you have, Lisa? So now we can have a back and forth conversation.
I love that.
Awesome.
I also, one of the biggest takeaways from talking today is what you said about we have to clear these bugs each day. We got to clear them out every day. It's not something where we want to let them build up. It's just like dust or dog hair or whatever else, right? All of those things, like, if you clean daily, there won't be a buildup. It's no different.
Yeah. Sometimes, it's like you said earlier, the mouth is not a box. It's connected to everything. If we have unhealthy bacteria in our mouth, it is in your body, everywhere.
It's everywhere.
It's everywhere. Awesome. Well, I hope everyone enjoyed this episode and has a better understanding of, do you need that deep cleaning? If you want that home care guide, just go to mouthymatters.com, pop in your email address, and it will be delivered straight to your inbox right away. And we will catch you next time. Thank you for listening to Mouthy Matters. If this episode helped, I'd love it if you shared it with a friend or left me a quick review. It really helps the show grow. And if you want a simple next step, download my 6-minute guide. It's in the show notes. We'll see you next time.